Hello everyone, welcome back to the channel. In today's video, we will talk about 8 skin signs of diabetes. Diabetes is a chronic metabolic disorder that affects millions of people worldwide. It occurs when the body either doesn't produce enough insulin, which is referred to as type 1 diabetes, or when the body becomes resistant to insulin. This is known as type 2 diabetes. Both cases lead to high blood sugar levels that, if left untreated, can result in complications like cardiovascular disease, nerve damage, kidney disease, and eye problems. While most people associate diabetes with symptoms like increased thirst, frequent urination, and fatigue, the skin can also reveal crucial warning signs of the disease. Many individuals with diabetes experience dermatological complications, some of which may appear before a formal diagnosis. In fact, dermatological symptoms are among the earliest warning signs of diabetes and can provide crucial clues about underlying health issues. Early recognition of these skin signs can help with timely intervention and better management of diabetes. In this video, you will learn about 8 common skin conditions that are commonly linked to diabetes. Acanthosis nigricans is one of the most common and well-documented skin conditions linked to insulin resistance, often seen in individuals with type 2 diabetes or prediabetes. This skin condition manifests as dark, velvety patches, primarily in the folds of the skin, such as the neck, armpits, and groin. In some cases, it may also appear on the hands, elbows, and knees. This condition is strongly associated with insulin resistance, a hallmark of type 2 diabetes. When insulin levels are excessively high, it stimulates skin cells to grow at an accelerated rate, leading to thickened and hyperpigmented areas. While acanthosis nigricans itself is not harmful, its presence indicates underlying metabolic dysfunction. It serves as an early warning sign for prediabetes or undiagnosed type 2 diabetes. For instance, a longitudinal study in the Lancet Diabetes and Endocrinology found that individuals with acanthosis nigricans were 3 times more likely to develop diabetes within 5 years compared to those without the condition. If you notice these patches, consult a healthcare provider. Lifestyle changes like weight loss, improved diet, and regular exercise can help manage acanthosis nigricans. Medications like metformin, which improves insulin sensitivity, may also be beneficial. Remember to always consult a qualified healthcare provider before making any medical decision. Diabetic dermopathy, also known as shin spots, is the most common skin manifestation of diabetes. It appears as round or oval, brown, atrophic patches on the shins, often mistaken for age spots or scars. These lesions are linked to microvascular changes, which affect small blood vessels in the skin and are more prevalent in individuals with long-standing diabetes. These patches are usually light brown and slightly scaly, but do not cause itching or pain. While these lesions usually appear on the shins, they can also occur on the forearms, thighs, and scalp. The exact cause of diabetic dermopathy is unknown, but it is believed to be related to changes in small blood vessels due to chronic high blood sugar levels. These skin lesions result from nerve damage or poor circulation, both of which are common in diabetes. While these spots are generally benign, their presence may signal the need for better glycemic control. Regular monitoring of blood sugar levels and routine checkups with your healthcare provider are essential. Necrobiosis lipoidica diabeticorum is another cutaneous manifestation of diabetes, albeit less common than diabetic dermopathy. It manifests as raised, reddish-brown plaques with a shiny, yellowish center, often appearing on the lower legs. Unlike diabetic dermopathy, necrobiosis lipoidica can cause pain, itching, and ulceration when left untreated. Necrobiosis lipoidica is a chronic inflammatory skin condition that usually affects the lower legs. It starts as small, reddish nodules that gradually expand into larger, waxy, yellowish-brown patches with prominent blood vessels. In severe cases, necrobiosis lipoidica lesions can rupture, leading to open sores that take months to heal. This complication increases the risk of infection and scarring, underscoring the need for prompt medical attention. Necrobiosis lipoidica is thought to result from inflammation and damage to small blood vessels in the skin, leading to the characteristic lesions. It is more common in women and individuals with long-standing diabetes. Topical corticosteroids and phototherapy are commonly used treatments for symptomatic relief. In refractory cases, systemic medications such as immunosuppressants or anti-inflammatory drugs may be prescribed. Additionally, lifestyle interventions aimed at improving blood sugar control remain foundational to preventing recurrence. Diabetic blisters are a rare but distinctive skin lesions that appear suddenly without signs of infection or inflammation. They resemble burn blisters and are usually found on the hands, feet, fingers, or toes. These blisters often appear spontaneously in people with diabetes, particularly those with long-standing diabetes. The blisters themselves are typically painless, but they can become painful if they become infected or ulcerated. The exact cause of bullosus diabeticorum is unknown, but it is thought to be related to the complications of diabetes, such as nerve damage and impaired circulation. The blisters usually heal spontaneously within 2 to 6 weeks without scarring. Keeping the area clean and avoiding popping the blisters can prevent secondary infections. Another skin complication that can arise from diabetes is diabetic foot ulcer. It is one of the most severe complications of diabetes, often resulting from neuropathy and poor circulation. It can lead to chronic ulcers, infections, and even amputations if left untreated. Diabetic foot ulcers result from high blood sugar levels that damage nerves and blood vessels, thus reducing sensation and blood flow to the feet. This makes it easier for minor injuries to go unnoticed and develop into serious infections. To prevent diabetic foot ulcers, daily foot inspections, proper hygiene, and wearing appropriate footwear are crucial. Moreover, regular foot examinations by a healthcare provider can help detect early signs of ulcers. Yet another skin complication that can arise from diabetes is eruptive xanthomatosis, which presents as small, yellow, itchy bumps on the skin. It involves the formation of firm, yellow papules on the skin, typically on the buttocks, arms, legs, and hands. This condition develops in response to extremely high triglyceride levels, a complication seen in uncontrolled diabetes. When fat levels in the blood rise excessively, fatty deposits form under the skin. This results in firm, yellow papules appearing on the skin. Eruptive xanthomatosis is more common in individuals with type 1 diabetes, but can also occur in type 2 diabetes. Managing blood sugar and lipid levels can help resolve these lesions. You can consult your doctor for a comprehensive treatment plan, which may include dietary changes, exercise, and medications to lower triglycerides and manage blood sugar. People with diabetes are more prone to bacterial infections due to weakened immune function and poor circulation. Moreover, high blood sugar provides a fertile ground for bacterial proliferation. Additionally, diabetic neuropathy can mask early signs of infection, allowing them to progress unchecked. Common bacterial infections that can result from high blood sugar include boils, styes, infection of hair follicles, and carbuncles, clusters of boils that form deeper skin abscesses. These infections tend to recur unless blood sugar levels are well controlled. High blood sugar levels can reduce the body's ability to fight infections, making bacterial overgrowth more likely. Maintaining good hygiene, keeping wounds clean and covered, and monitoring blood sugar levels closely can reduce the incidence of bacterial infections. Antibiotics are typically required for treating active infections, but overuse should be avoided to minimize antibiotic resistance. People with diabetes are also susceptible to fungi infections. Fungi thrive in warm, moist environments, making them particularly problematic for individuals with diabetes who often have damp skin folds due to sweating or obesity. Candida albicans, the fungus responsible for yeast infections, frequently affects areas such as the groin, mouth, vagina, and between fingers and toes. Other fungi infections include intertrigo, which appears as red, itchy rashes and skin folds, and paronychia, a fungi infection of the nails. As noted in Mycopathologia, high blood sugar levels create an ideal breeding ground for fungi, providing abundant nutrients for growth. Additionally, compromised immunity reduces the body's ability to combat fungal invasions effectively. Fungal infections can persist despite treatment if blood glucose remains uncontrolled. Chronic exposure to antifungal medications may also lead to drug resistance, which further complicates the management of the fungi infection. If you notice any of these fungi infections, it could be a sign of diabetes, and I recommend checking your blood sugar level. To combat these fungi infections, antifungal medications, both topical and oral, are effective treatments. However, maintaining stable blood glucose levels remains fundamental to preventing recurrences. Also, keeping affected areas dry and wearing breathable fabrics can also aid in recovery. In conclusion, diabetes affects the skin in multiple ways, and the skin manifestations of diabetes are more than just cosmetic concerns. They can provide critical insights into your metabolic health. Recognizing these signs early can lead to timely diagnosis and better management of diabetes. If you notice any of these skin changes, consult a healthcare professional for a thorough evaluation. The bottom line remains that managing your blood sugar levels through diet, exercise, and medication is the best way to prevent and treat these diabetes-related skin conditions. Remember, by staying informed and proactive, you can take control of your health and reduce the risk of complications. Your skin might be telling you something important. Listen to it. And that's it for this video. Thank you for watching. If you find this information useful, hit the like button and consider subscribing to get updates on my future videos. Together, we can defeat diabetes and live a happy and healthier life. Until next time, goodbye.